Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how to best leverage and optimize laboratory services for patients, clients, and staff. I'm your host, Jane Hermansen. I'm the outreach manager at Mayo Clinic Laboratories. And joining me today are my two favorite guests, Dijkman Dulkes and Brianne Newton, who are both outreach solutions strategists within Mayo Clinic Laboratories. Our discussion topic today is part one of two about why laboratory outreach programs fail. And when you think about failure really has two aspects. One is trying and not being effective, defeat, essentially. And the other one is related to not even trying, non-performance, or just not even starting. That's also a form of failure. So that's how we're going to split the podcast into two parts. So today we're going to talk about the first one, trying and not succeeding. So that is failure, defeat. And you know me probably well enough by now to know that these words are really painful to even say in the context of a lab outreach program, because honestly, it doesn't have to be that way. So why do lab outreach programs fail? Well, on our website, on mayocliniclaboratories.com, we list the 11 tactics that we feel lead to the highest level of laboratory outreach success. Two of them are administrative support and organizational culture. And if you don't have support from your top bosses or an institutional desire to have a successful laboratory outreach program, you are certainly going to fail. So let's start with the lack of administrative support for our first topic. And I'm going to start with you, Ellen. So Ellen, what do you typically see happening when an outreach program doesn't have support from their hospital's leadership?
Well, from my own experience, it was competing priorities. And I hate to say it's us versus them, but the internal competing priorities related to maybe growing as a health system or, IT, for example. Doing the lab test is the easy part, but IT resources, as you know, are incredibly limited in connecting the instruments, and clients they don't want to send paper. They want IT resources to place the order, and they want to get the results, and they want to get electronic bills. But if you only have a limited number of IT resources and you want to grow your health system, or you're maybe getting a new LIS, then, the client really comes after the internal growth of those projects. So I think that's a big us versus them kind of competing priority. Call center is another one. Managing the day-to-day operation of a call center gets overwhelming for the call center, and not taking the time to manage the KPI metrics related to customer service.
Ellen, thank you so much. You talked about competing priorities. You talked about lack of resources and the impact that that might have on some of the customers. So, Brianne, if I had to really think about what Ellen shared, it's really that a lack of investment could be a major reason for outreach program failure. And since senior administration is really the group that frees up those resources, what other reasons could you see for them not willing to engage or not supporting the program?
Oh, that's a good that's a good question, and almost one that matches up with my previous life before coming to Mayo. Um, One of the best ways to kind of get senior leaders on board and help them kind of loosen purse strings a little bit is to show them as a lab leader that you have a plan, that there is a strategy for where you want the laboratory to go. Yes, you're responsible for putting out fires every day, but there needs to be a direction and a vision for where you want to take your laboratory department and outreach specifically. The best way to do that is to learn to speak executive language. Sometimes that's dollars, sometimes that's strategy. And so one of my highest, uh, I guess, pieces of wisdom maybe that I received from another leader in another department was, hey, match your strategy for your department with where the hospital or the organization is going. Just walk step in step with, take your plan, match it to where the strategic plan for the organization is laid out. And it's hard to argue that. It's hard to say, no, that's not really where we want to go. Oh, really? Because we're going the same place you're going. And
Yeah,
so
let's look at our mission statement again, shall we?
yes, exactly. Take a peek up there on the wall and see what it says. So that's a great one. But if you're not able to articulate that, if you don't have a plan, then it's hard for senior leaders to understand, well, why do you need more resources? Why do you're not going anywhere? And so that's a huge piece, I think. Another one is to be able, as I mentioned earlier, be able to convey the importance of the financial contribution to the lab, from the lab to the organization. How much are you putting in? And that's another key secret to communicating with executives, is getting on the dollar level. If you don't know that, learn it. Very important, because you have to be the person, you have to be the champion as the lab leader to help others understand, even though we're only doing $20 CBCs, when you do thousands and thousands of them, that small dollar contribution adds up quickly. But side by side, your small dollar test versus a large price tag imaging study doesn't really look like you're the one that needs the financial resources. So again, a communication to senior leaders that yes, our items are small dollar, but boy, we sure do a heck of a lot of them. and
Mhm.
and making sure that they understand that. Last thing, sometimes it's a personal interaction with the laboratory. So a senior leader doesn't want to buy in to what you're doing, or maybe isn't understanding because, heaven forbid, the only interaction they've had with your lab services was a negative one. Maybe the phlebotomy collection experience wasn't great. Maybe there was some issue with the testing results. Maybe there was something like that. And that can happen with any customer. But oh goodness, it's hard when it's a hospital leader that happens to. And so, really trying to drill into what happened during their experience, and maybe even engaging in a conversation to let them know, hey, what's happened to you, I've actually addressed. Let me tell you about it a little bit. Thank you for letting me know that happened, because we uncovered some process changes that we needed to make. So several different things on lots of
Yeah.
areas, but so much of that comes from a lack of knowledge or a misunderstanding, or a lack of communication on the lab leader's part on just how important the lab is to the organization.
Absolutely. Well, I like how both of you described that, because when you think about it, the administrative support is what I would consider table stakes, right? You have to have it, but they've got other things on their mind. They may have a bias. They may not be thinking about laboratory. We might be a well-oiled machine and we're not even on their radar. So in some cases, a solution could be maybe some effective business planning, having a really clear vision for where your laboratory outreach program needs to be. And as you said, Brianne, aligning it with organization. And from your perspective, Ellen, helping them understand, especially to make an IT investment, because IT resources are so constrained, why do they need to support these, and show some KPIs, key performance indicators, to indicate why that's important. And if you already have effective IT with one outreach customer, how can that actually breed more success with future customers? So speaking of the customer, so you fail if you don't have support, if you don't have a good foundation, right? But from the customer's perspective, what are the reasons that a customer may start to use the laboratory and then stop? And Brianne, since you were talking last, I'm going to go back to you again. What are you seeing? Why would a customer stop using the laboratory?
Mm. And boy, doesn't that hurt? Because
Yeah.
you sit there and you just think, oh, I had this customer and things were going great. Well, maybe it wasn't. Maybe it wasn't going as great as you thought. So there are several reasons, and some of them you may be aware of, some of them you may not. And so it behooves you as the lab leader to dig into your processes to make sure that something is not happening on the backside type of stuff that you're not even aware of. So sometimes that can be, maybe the patients are getting a surprise bill that you didn't even know about as the lab leader. Like, oh gosh, this actually happened with a client of mine. They did not know that their patients were receiving a second bill from a medical director pathology group on top of the bill that the lab was sending. Had no idea. And they were just humiliated about it, because it was like, oh, we've got to fix this. This is why people are getting angry. So sometimes it's surprise bills. Sometimes it is, you need to do your homework in your own market and be a secret shopper. Get a hold of the price lists of your competitors, however you need to do it, but make sure that you're not pricing yourself out of your own market. Look and make sure you don't have to be the bottom. We're not racing to the bottom of the price list, but be in the same ballpark. Be competitive. And you might offer, additional customer service experience type of things that make your a little bit higher prices worth it, but at least be competitive. And so sometimes it's prices like that. It could just be some processes of yours. We've talked about processes already, KPIs, things like that, that we always want to watch in the lab. But maybe you have processes that leave gaps to where a specimen could be easily lost, or there is a step that's being dropped or a hold or something somewhere. And so looking at your processes really closely to make sure your customers are not experiencing those as they go through.
Sure, absolutely. So from the process perspective, billing perspective, it sounds like some of the stuff could actually come back to communication and maybe even a breakdown in communication. So Ellen, I'm going to turn this over to you now, since we're talking about communication. When you look at laboratory outreach programs, what are some of the most common communication mistakes that could impact a customer, things that you see? And what might cause a customer to change to a different laboratory, just in the communication lane?
Yeah, so I think those really hit all three phases of lab testing, from the pre-analytic to the analytic to the post-analytic. And these are big issues, right? So pre-analytic, it's the rejection of specimens and specimen acceptability. If they're getting called all the time after they sign the contract and we're calling them that they're rejecting specimens because they didn't put the right name, and they're getting, and they're like, why am I using this lab? That other lab used to accept them all the time, and now this lab isn't, and they can't fill out a requisition right. And the courier schedule, the courier, is sitting there tapping their watch, and that isn't even going right. That they're going to be like, why did we pick this lab? And then analytic, they don't know that a specimen was canceled until they look in the LIS, and they're like, well, how come no one called me? It's been 3 days and no one called me. Or maybe a critical, they didn't know they were going to get called in the middle of the night, and their doctors are very upset because no one told them that there's a list of criticals that they would get called on, and maybe that other lab never called them. Well, you're getting better continuity of care for your patients, but they didn't know this when the contract was signed. So these are all those things that affect this client if they didn't know up front what the administrator agreed to. And then post analytic, the billing and the resulting are huge. Maybe the provider at this new clinic or with this lab didn't want the preliminaries and the finals sent. They only wanted the finals, or they want the preliminary and the final. So these are all things that, not for sleight of hand, these are big things that need to be worked out, or there's going to be huge dissatisfaction. So communication is huge, I would say.
Well, and it sounds like it maybe starts with just good onboarding, getting good information,
Correct.
making promises that you can fulfill. Don't make promises that you can't fulfill. And if you get off to a good start, chances are you're going to have a better relationship in the long run. But I think that all of those things that you both talked about are incredibly important. And I know we think a lot about selling and bringing new business on board, but fun fact, it's actually 5 times less expensive to keep a customer than it is to get a new customer. So don't you want to keep that existing customer? Retention is really powerful. And yes, of course, continue to grow. But if you don't make these mistakes and you actually have the right, probably a two-way conversation and relationship with your customer, you're going to have a higher level of success with retention. So those are a couple of reasons for failure. First was kind of that administrative view. Second is the customer's view. And then sometimes, stuff just happens. And when I thought about the reasons for outreach failure and how do we kind of shape this conversation today, the last reason for outreach program failure that I could think of is just kind of all the stuff that falls into that category of things we can't control. So, Ellen, I want to start with you. What types of things do you see in this area? Stuff that you can't control. Stuff happens and there's nothing we could do about it. What kind of stuff do you see there?
You work with a lab all the time, and then, they become a member of a different family, higher up in the food chain, and like Pac-Man, they become part of a different organization, and all of a sudden they have to work with a different reference lab or a different organization. And I think you can't control that, or regulatory changes, or, stuff happens, and that you can't control. And I think that's the hard part. is that maybe you want to work with somebody or do something and you just can't. So I think that's probably the biggest one.
Sure. I think one thing that I saw was an outreach program failed, and this goes back a number of years ago, but when the regulations changed related to skilled nursing nursing
Hmm.
facility billing, and the organization was not aware of the regulatory change, and they hadn't started to pay attention to the part A and part B patients, and it just turned into a disaster of billing. And by the time they figured out where they were behind, it was so bad that they just had to kind of exit that market. So it wasn't really customers leaving them, but it was a regulatory thing that they couldn't control. And they just had to kind of push the stop button and do a reset before they could actually get in. So these are things that we need to pay attention all the time to, that stuff that we don't control. And the other thing that I think is sometimes us assuming that other groups in our organization can do a good job, because we have good labs and we work in good organizations. So sometimes the laboratory says, you know what, it's okay. I will let the physician liaison group handle lab. I will let the hospital billing department handle lab, no problem. And nothing's worse than allowing somebody else to tell your story. Nothing's worse than allowing somebody else to pay attention to your money. And they're setting write-off policies that might be $250. And what happens is that all of your lab claims are being written off because it's not a priority for anybody. So it just comes down to, there are some things that we can't control, but how can you actually influence? Maybe it's not a control piece, but it's an influence and communication to make it better. So I think where we've kind of fallen into with failure is, for me, I don't see failure as an option, truly, in an outreach program. I don't think that any of these things are insurmountable. So through the podcast, we've talked about some of the big and visible things: administration, resources, big errors, things like that could happen. Brianne, we've talked about the big stuff. I would like you to share some of your thoughts related to some of the subtle and maybe controllable, the little things that can actually create the opportunities for failure, or at least create the system in place for failure. What are the things that you're seeing that really create a lot of challenges for labs?
Mm. And it's the subtle that always gets us, right?
Yeah, yeah,
Because unless someone points it out or someone happens to hear this, it may be something that someone's doing and doesn't even know, or doesn't know that it could be different. And so some of those that I know all three of us have seen in our clients or have been exposed to elsewhere is that, as I mentioned earlier, there's no focus to the outreach program. It's just kind of like, we're just going to try and start this and do this. There's no vision, there's no direction. Some of it, and that one I think lies completely at the feet of the lab leader that's responsible. That's something that you need to do. Other things, though, are not necessarily their fault. And one of them that I personally see often, I know you guys do as well, is that I'm going to say a lab director. I say lab leader, but a lab director usually is tasked with starting an outreach program and then continuing to operate it. So it is a multitasking function where it's kind of like, hey, here's this cool new side hustle. Why don't you do this on top of everything else you were doing,
right.
which was a full-time job? And so now you have at least two full-time jobs and can't dedicate your whole self to any of them. And if you do that, then if you treat it as a side gig, then that's all it will ever be. And you will limit the success and the reach and the effectiveness of that. If you can position yourself and position the message that you create around your outreach program, that it needs its own leader who can report to you as the director, but that you need someone to manage it, someone to oversee it and grow it as their own baby, it will be so much more effective that way. And then the last one, which is happening in lots of areas of the lab, which is someone knows the ins and outs of everything about the outreach program, and then they leave or they retire. And there's not been any dissemination of that information to anybody else. There's no succession planning. There's no, growing up these young leaders to see what potential there could be. And so all of the knowledge and the wealth of experience through the outreach program leaves with that person, and everyone else is kind of left drifting. And so those are kind of subtle things that, yes, can be addressed and should be addressed, but may not be as obvious as some of the other stuff that we've talked about.
Sure, absolutely. Ellen, how about you? Are you seeing anything that's more subtle or even insidious that can cause outreach program failure?
I would just build on what Brianne said and put some formality around to it, and look how your org chart is set up and who reports to who, and what it looks like. Because I think the org chart can go a long way in just sort of formalizing it or making it look informal.
Sure, sure. Or taking it and removing it from the laboratory, putting the outreach program separate from the laboratory might be an outpatient care function. So putting it under an outpatient umbrella and then having kind of a battle between the lab and the outreach program, it creates that we, they, rather than we're all are part of this together.
Right.
So none of these things are fatal, but you certainly need to be intentional about it to make sure that you've got the right coordination process. So I think that those are really powerful statements, because it's the insidious stuff and we just kind of do it and we allow it to happen because we're good people. It's like, yeah, I can do 2 jobs. But if outreach is not treated as a strong initiative, it will be a hobby. And sometimes you lose focus on your hobbies, and that can be a true reason for failure. Guys, we've had some good conversation already about laboratory outreach program, and we're going to continue the conversation in part 2 of the podcast. So what we're going to do now is wrap up part 1 of the podcast on outreach program failure. And of course, my rapid fire response questions. So if I had to pick one for us today, I'm going to start with you, Ellen. What one tip would you give to an outreach program to help them not be a victim to any of the issues that we discussed today?
I would say patients and clients have a choice of what lab they choose. See it from their perspective. They want to do a good job. They don't know how. So help them to help you.
Okay. Brianne, how about you? What one tip?
I would say, as the lab leader, do your homework, follow your specimen, and walk through every part and piece of your outreach program so that there are no surprises. You'll know all of it, warts and all, and then you can start improving the processes that need improving so that there are no surprises that are driving your customers and your patients away and you don't even know about it.
Fantastic. Thank you, guys. And from my perspective, I always look back. I look to the top and the table stakes. From my view, I would say make sure that you are doing everything you can to bring your administration along the journey, because when you have their support, it's a whole lot easier to get this work done. So thank you, Ellen. Thank you, Brianne. And although we didn't like really talking about outreach failure, hopefully the audience has learned some of the reasons that an outreach program fails to deliver on that community-based mission. So audience, please tune in for part 2 and learn about how that inertia of inaction, not doing something, can be just as dangerous to an outreach program as the things we talked about today. And if you want to know more about laboratory outreach success, you have an opportunity to hear from the Mayo Clinic Laboratories outreach team and many other outreach experts at our upcoming outreach conference. Leveraging the Laboratory Vision to Action will be held in Nashville, Tennessee on September 16th and 17th, 2025. Registration is now open. Go to mayocliniclabs.com/education for more information. And thank you again for joining us today. Thank you for listening to Leveraging the Laboratory, a podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.